Welcome. I am sitting here with Angie. Angie is here for her consultation. And Angie was actually referred for a consultation by Jenny Smith. Jenny Smith is one of our sales executives. So Jenny, thank you very much for referring Angie. Actually, they're cousins. And I understand, Angie, that you are a mom of a 3-year-old and a 4.5-year-old.
Correct.
That keeps you very busy.
Yes.
Because you were telling me that they love to be outdoors, so you're outdoors a lot, but you also work part-time.
Yes.
As a bookkeeper?
Bookkeeper, so I'm in the office 3 days a week.
Okay. Well, I'm going to ask you a few questions. So if there was something you could change or improve about your skin, what would it be?
To not have acne.
Okay.
So just clear skin.
Anything else you'd like to change or improve?
Those dark circles under the eyes, they seem to be getting darker and darker.
Anything else?
Maybe just, I guess, along with the acne, smaller pores
Okay.
on the nose.
Anything else at all?
That's it.
Is that pretty much it?
That's pretty much it.
Okay. So tell me, what type of skin do you think you have? You think it's more normal, oily combination? How would you categorize it?
Oily?
Okay. Are you oily everywhere on your whole face or just certain areas?
Mostly the forehead.
Okay. How would you categorize like the cheek area? Is that really oily?
Not as much, no. Just the forehead and the nose.
Would you say your cheek area is more normal?
Yes.
Okay. So the reason that I kind of ask that question that way is that oftentimes if people have a particular area of their skin where they're really oily, they'll categorize their whole face as being oily. But unless their entire face is really oily, sometimes you can actually sort of misdiagnose what type of cleanser they should use because their face is really more combination. And you end up drying out the areas that are not really oily. Okay, so you're really kind of combo. And have you ever been a smoker?
No.
Okay. How about a sunbather? Were you ever a sunbather?
Yes. Yeah. And then teenage years.
Teenage.
20s, yeah.
Okay. So tell me typically where you tend to break out. Where do you think you have acne?
On the forehead.
Okay.
I don't get very many breakouts anymore. It's just the way the skin looks right now. It's just very bumpy.
Okay.
And then I get like these white heads. And when they appear, they last for years before they're gone.
Now, do you ever get what we call nodules or mini cysts? Those are the ones that are kind of those underground big ones.
I think I have like 2 right now.
Okay.
Yeah.
And where do you typically get those when you get them?
I have it on my cheek and on the side.
Okay. And so, did you have acne as a teenager?
I did.
And do you think it was worse when you were a teenager?
It was different. It was more of just having occasional breakouts. But I feel like right now my whole skin is just what I call bumpy. It's just not smooth.
So when you had the occasional breakouts, typically where were they?
The chin, the nose, the cheeks.
So would you say that you actually feel like maybe your skin was clearer as a teenager than it is now?
Yeah, I do. And then when I was in my early 20s, I did Accutane. I took that for a while.
Okay.
And that really cleared up my skin. And my skin stayed clear for a very long time. And I really didn't have too much complaints about it until after I had my first child. That my skin just changed. Do you remember what the dose of Accutane was? the minimal dose.
Like 20 milligrams twice a day?
I think so.
So take it morning and night.
Yeah, they just did it for a couple months. They don't do it that long.
Okay. Okay. And you mentioned dark circles. Is that something that you've kind of always had a tendency toward?
No, again, just after kids were born. So I feel like when I was younger, it wasn't a problem.
And then you talk about wanting to have smaller pores, or sebaceous follicles as we call them. And do you, just basically, were you talking about the nose area? Do you feel like you have enlarged pores anywhere else?
I think just the nose area.
Okay.
Yeah.
And has that always been an issue, or just?
Yes.
Okay.
Yeah, that's always been an issue.
Okay. Let's talk about what you use currently. So, what do you wash with in the morning?
I'm very bad. I'm not very consistent about using anything in the morning. I'm more in the evening. I have the Neutrogena makeup remover to remove the foundation.
Is that like a pad?
Yes. Yeah. And then I like the Clean and Clear scrub I use. It has like, I don't know what they're called anymore, but it's like a scrub, so it's vigorous. So I like to use that.
Okay.
So that's pretty much.
So in the morning, do you use any water? Do you splash your face at all? Do you do anything?
Yeah, just in the shower, water. Yeah. And then I use a moisturizer.
And what moisturizer do you use?
I've used Aveeno. And it has the SPF 30 that comes with it. And then Jenny, every once in a while, will get some of her great cream. I love the moisturizer. Yeah.
Okay.
That's it.
Yeah. And so basically what you do is it'd be the water in the shower, and then the Aveeno moisturizer, which has an SPF 30. Okay. And then at night, you use a Neutrogena makeup remover, which is kind of like a pad, or, you know.
Yeah.
And then you use Clean and Clear scrub. And do you do anything after that, after the Clean and Clear scrub? Do you moisturize or anything like that?
No, not consistently. I've tried some products over the counter for just to relieve the acne. What's it called? Differagel?
Different?
Yeah, I used that one. That didn't do anything.
Okay. And have you tried anything else? You ever tried benzoyl peroxide, anything like that?
Not lately. The stuff like that when I was a kid or a teenager.
Okay. And so, do you do anything, so no moisturizer or anything like that after the Clean and Clear scrub? Do you ever use any other kinds of masks or anything like that on an occasional basis?
No.
Now, have you gone back to see a dermatologist after you were on the Accutane, but have you gone back since the acne has kind of come back?
It's kind of funny because I did go see a dermatologist, and the dermatologist's skin was worse than mine. And she didn't seem to think that my skin was that bad.
Oh, okay.
So I really didn't get anywhere with her. She didn't, I think she recommended just something, the peroxide, it's like 10%, to put on if you have breakouts. But, I didn't really get anywhere with her. She said my skin wasn't that bad. But
well, obviously it's subjective and it's individual. And having come from being a 2-time Accutane failure myself, and having had severe cystic acne, and perfect skin as a teenager, I got it when I was around 19. I've actually had dermatologists say, "Oh, your acne is not that bad." And any acne, if it bothers you, if you feel that it's defeating socially, if you don't like looking in the mirror, if you look at other people's skin and you envy them, it's all bad. And I've never had anybody say to me ever, "I don't want clear looking healthy skin." I want really bad looking skin. Everybody wants clear, healthy looking skin if you have your choice, right?
Of course. Yeah.
So obviously there's a way to get it, then that's what we want. Okay, so let's talk a little bit about the acne and some of the dark circles and some things like that. And I want to sort of just give you a baseline, and maybe when you went to the derm, they might have talked to you about this, but I want to kind of give you a picture and understand the acne process, because if you understand it, then you're more likely to really grasp why we recommend certain kinds of topical agents and why they work or what doesn't work and what you need to do consistently. So, you probably heard this before, but it might be a little different this time. When you touch the outside of your skin, that's the stratum corneum, and it's a dead layer. And we shed about 500 million cells a day, but we're not aware of it. They're little microscopic cells. You shed them everywhere. Now, when you look at a pore opening or what we call a sebaceous follicle, you probably think, I know I used to think, oh my God, there must be some big cavern in there. But actually, it's about as big around as the diameter of a hair. And inside the follicle, it's lined with dead cells. They're constantly shedding, just like they are on the outside of the skin. And then you have your sebaceous follicles down at the bottom. Sebaceous follicles produce oil, and the oil pushes the cells to the surface. They sit there and they fall off. And that's the process. That's what's supposed to happen. Now, in individuals that have acne, and acne is an inflammatory disorder, and in individuals that have acne, what happens is the cells in the follicle, for whatever reason, they tend to stick together. Now, when this process first starts, and how old were you when you think your acne first started? When you first started to notice any bumps or anything?
14.
Okay. Well, actually, the average age today that women develop hips is about the age of 8. And the onset of puberty is defined by breast development, not menstruation. So if you've got somebody who's 10 years old and maybe they're starting to develop breasts, or 11 years old, they're in puberty. And you can begin to develop these microcomedones, which are little tiny cells sticking together, and you don't know it because they sit there and they're dormant. And sometimes when kids are like 11 or 12 years old, you can start to see tiny little just bumpiness on their skin. And that's the beginning of the acne process. So it could have been starting a lot longer or a lot well before the age of 14, but it's something where you just didn't notice the breakouts until 14. So at any rate, these microcomedones can kind of be dormant for extended periods of time, but it can also take days, weeks, months, or years if they're active to actually get to the surface where you actually see something. So what happens is the cells keep sticking together, stick together, stick together. Your follicle needing more room can actually dilate. You see that as a clogged pore, like what you have on your nose. That is actually a form of acne, but it is the least aggressive form of acne. When it becomes more serious is when it becomes sort of closed comedonal acne. And that's where you start to get these bumps. What's happening in the follicle is that the cells are sticking together and the cells begin to trap oil. And the oil also traps P. acne bacteria. Now, P. acne bacteria is harmless. You can't catch it, you can't spread it, but when it's in the follicle and it's trapped and there's less oxygen in that trapped environment, it really flourishes, and what it does is it eats your oil. That's what it uses for food. And it excretes a fatty inflammatory acid byproduct. Now, if everything stayed in your follicle, you never get bumps, you wouldn't break out. But what happens is that this inflammatory byproduct that's excreted by the bacteria wears your follicle walls down. When they get to the point where they just can't withstand the stress, they can't stretch anymore, you get what is known as a leak, a rupture, or blowout. So a leak is where you're going to see a little bump. You might see a papule, a red bump. You might see a pustule, a whitehead. Those are considered to be not as severe a form of acne as nodules and cysts. So a nodule is where the side of the follicle kind of blows up. You get more material on the outside, and as it makes its way to the surface, it's an inflammatory process. You get this nodule, which can take a long time to go away, may or may not scar. Now, oftentimes you're left with discoloration. That's not a scar. that can go away. It can take a long time depending on the skin coloration. A scar is more if you have a loss of tissue, there's a divot, there is an actual scar. And then if you have literally where the side of the follicle literally just blows up, that's going to be a cyst, the really, really deep, large ones. Now, cyst scar, because the inflammation is really low, hits the dermis, destroys collagen and elastin as it makes its way to the surface. And so you always have scarring, pretty much always with cysts. So here's what we need to do. We have to do a couple of different things. Number one, we have to introduce something in the follicle that actually addresses the P. acne bacteria. If we can keep those colonies of bacteria down where they're sort of bactericidal, bacteriostatic, we can't kill them forever, but we can keep the levels down where they're not eating the oil, then that makes a huge difference. So that's number one. We have to introduce something that keeps them down low. The second thing that we need to do is we need to introduce something in the follicle that keeps those cells from sticking together. So if we can interrupt the acne process, then that makes a huge difference as well, keeping your skin clear. And it also, when you can address retentive material in the follicle tends to relax. It's not being dilated as much. And so as it relaxes, your follicle looks a lot smaller. They're not trap doors, you can't just open and close them, but you can really refine them and make them look a lot better, make the skin look a lot smoother. Give it that more flawless, airbrushed look. We also need to deal with inflammation because acne is an inflammatory disorder. Now, here's the good news. Excuse me. Things that we use that address those issues also make a huge difference in what we call resurfacing. Let's just say that your primary concern was fine lines, or just that you wanted your texture to look a lot smoother. You wanted your follicles to look smaller. You wanted your skin to look more even, more airbrush looking. I'd use some of the same topical agents. So in terms of the resurfacing department, that's one of the things we're going to employ. The second thing we're going to do as far as the P. acne bacteria is we're going to have you using a combination of benzoyl peroxide and retinol. Now, this is duality. And what this is a product that has two chambers. And in one chamber is the benzoyl peroxide, in one chamber is retinol and some other kinds of ingredients. And the reason we don't put them together in the same chamber is because they're not compatible. For years, I had physicians saying to me, Jan, if you could put these two gold standard ingredients together that are absolutely remarkable for acne, that would be fantastic. But if we had them in the same formula, they render each other inactive. So that's why it's in a dual chamber. So let's talk for a moment about the benzoyl peroxide. So the benzoyl peroxide has a really bad rep because it's thought of as a teenage medication. It's going to dry your skin. This is a very different type of benzoyl peroxide. So first of all, the way the benzoyl peroxide works is benzoyl forces peroxide in the follicle where it releases oxygen. P. acne bacteria can't live in the oxygen. It kills it better than anything that we have ever seen. If it works for you once, at the percentage we're talking about, it'll work for you forever. That's a statement by the American Academy of Dermatology. And also, benzoyl peroxide is, and this particular benzoyl peroxide does not dry the skin. And by the way, one thing I want to mention before I get into that part, there's a misunderstanding about benzoyl peroxide. So lots of times what happens is that people break out, they put benzoyl peroxide on the breakout, and then they wait for it to go away. And then they stop using it because the breakout is gone. It's a preventative. Once you have an acne lesion, that's the end of the process. So it's a preventative. If you miss one day, maybe you won't break out that day. 2 or 3 days later, though, you probably will have a breakout. So you use it consistently. I use benzoyl peroxide every single night to this day on the areas where I know I would have a tendency to break out. I never break out, and my skin isn't dry. It's not flaky. So this is a benzoyl peroxide that is a much smaller micron size. Instead of being the average of 60 microns, it's like 5. It penetrates really fast, bypasses the surface, doesn't dry. It was tested in 20 degree below zero weather in Alberta, Canada by Dr. Jaggi Rao, who is a board-certified derm in Canada and in the US, and he's also the head of the dermatology residency program at University of Alberta. And he's the CEO and founder of the Acne Clinics of Canada. So he treats more acne than virtually any other doctor in Canada. And the patient's skin was actually more hydrated after the study than before the study. So you don't have to worry about drying out. Plus retinol. Now retinol is not only great for acne, but it also is tremendous for the appearance of fine lines and wrinkles, pore size, all the kinds of things, evenness of skin tone. There is something in the retinol that can help your discoloration go away about 300 times faster. So in terms of evening out your skin tone, just making it look more uniform, making it look younger, healthier, preventing some of the sun exposure, some of the damage that you're going to see from your sun exposure, most of which happen before the age of 10, at least 50% before the age of 20. So that's going to be the primary focus for the acne, but we're going to put you on what's called a skincare management system. So you're going to go on the entire skincare management system because besides this being very anti-inflammatory, one of the products in here is something called BioClear. BioClear is glycolic, salicylic, and azelaic acid. Azelaic acid is sold by prescription for rosacea, sold by prescription for acne. It's one of the best resurfacing agents we've ever seen for fine lines and wrinkles, the appearance of fine lines and wrinkles, and for the appearance of your follicles. It just makes everything just look so much more refined. It makes your follicles look so much smaller. And it's very fast, works very, very fast. So the two main components are going to be the system and the duality. Now, what about your dark circles? You know, people used to ask me, what can I do for dark circles? And I had this really sarcastic answer. I'd say, pick your parents, because they're hereditary. They're hereditary. Did I say that right? Mm-hmm. It's heredity. And what you inherit is you typically inherit blood vessels that are closer to the surface. So they tend to be more visible. Now, why are they more visible as you get older? Well, because first of all, the skin around the eye area tends to thin. So you have skin, you have a membrane that kind of gives the eye area shape that acts like a girdle and that holds back like the fat, because at some point fat starts to herniate underneath the eye. You don't want to hear that, I know. But all that kind of helps to keep everything in a nice shape. And as well, if your blood vessels are back further underneath, they don't show through the same way. But when they're closer to the surface, what happens is that they engorge with blood and they're much more visible. And these blood vessels, along with skin, as sun exposure causes more and more damage, the blood vessels become damaged as well. So they don't necessarily expand and contract like they used to. Probably, I would venture to say that if you've got allergies, they're worse. If you have a cold, they're worse. If you don't get enough sleep, they're worse. And of course, you've got 2 little kids. So who gets enough sleep, right? Right. And there's just all kinds of things that can exacerbate it. So today what we can do is that we have something called Luminate Eye Gel. And Luminate Eye Gel, I have to tell you, is absolutely remarkable for the appearance of dark circles. And what it does is that it helps, first of all, to kind of deal with some of the factors like circulation, things that can keep those blood vessels from looking as engorged. And also, it has a direct effect on the appearance of fine lines and wrinkles. It just makes the eye area look a lot brighter. And I think that you're going to see a rapid difference. Now, can we get rid of dark circles in everybody completely? It depends on lifestyle, it's hereditary, it's all kinds of things, but we can definitely make it a lot better. And if nothing else, I always like to say at least we can make it look as good as it looks on your best day. When you have your very best day, you probably wish that's the way it looked all the time. So if we could have that consistency, it just makes it much more consistent and much better over time. Okay?
Sounds good.
Now, do you have any questions for me?
Do you think that I will break out when I first start the treatment?
That is a really good question. Sometimes people, and I find this in the majority of cases, is that they just notice their skin is just clearing up much faster. Occasionally, sometimes individuals will say, well, I'm getting some new breakouts, and really what it is, it's retentive material in the follicle coming out. But at the same time, they may also say, but I notice that my existing lesions are clearing up and going away a lot faster. It's important that you have some type of indication that your skin is clearing. Because if all of a sudden you just have this explosive breakout, it doesn't matter what I say. Nobody wants that. You don't want your skin to look worse, you want it to look better. But if you feel like, wow, these are clearing up, but maybe I just have a couple of new ones, then that's something that you understand that you're going through a process. But you're going to be able to call anytime you want, and we're going to walk you through this, okay? But that's a really good question. Any other questions?
No, I'm just foreseeing a lot of dryness, but we'll see.
Yeah, I don't think you're going to have any dryness. I think if anything, you're going to find that your skin is a lot more balanced. And one of the things I'll tell you, if you tell me a month from now, if you say, Jan, my skin's the best it's been in years, I didn't think I could get it this good, I can get it even better. I always say that, but it's true. So, any other questions? Anything else that I can answer for you?
No, that's it.
Great. Yeah. Okay. Well, I'm excited. I hope you're excited.
Yes, definitely.
And maybe you'll get to come back and visit us, and we'll get to find out how you did. So goodbye for now, and please, 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 please subscribe. Bye.